All. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So, thank you very much for joining me a little earlier today. I had an evening appointment, so apologies to spring it on you earlier, and have a nice weekend. So, here is a discussion. We were talking about berberine yesterday. We will continue the mechanisms discussion today. Once again, berberine has an effect on type 2 diabetes. It has an effect on glucose levels. That means please do not start using it without discussing with your doctor, without seeing what your situation is, what is the indication of berberine, looking at the side effects and the interactions. In this discussion, I'm not going into the side effects or interactions. Instead, I'm still explaining the mechanisms. I will take on the side effects afterwards and then drug interactions even after that. So let's start. So this is drbeen.com. In the description of this video, there is a link to a beautifully priced Dr. Bean access of about 900 lectures. So take advantage of that before we take that offer away, because it is about to go away as our testing for the courses page is almost done and we are about to launch that. With this, let's look at the two studies that I want to use as the foundation for today's talk. This one study is berberine improves glucose metabolism in diabetic rats by inhibition of hepatic gluconeogenesis. The second study is berberine lowers blood glucose in type 2 diabetes mellitus patients through increasing insulin receptor expression. So these are the two discussions. This one is quite involved and quite in depth. And as you can tell from the markings, I have gone through this in depth as well. So I'm going to give you a presentation of what these mechanisms are. So let's start that presentation. So these are gifts for humanity. They're continuing. And of course, if you would like to support this work, you can do so by seeing the links in the description to either use PayPal or Patreon or Substack or becoming part of this channel. So here is the map of the berberine's many effects. And once again, berberine has diverse effects. This particular set of discussions topics that I want to do today is all about glucose lowering effect plus liver healing effect. These are the two primary mechanisms that I want to discuss. So we'll start our discussion from here. So I'm going to zoom in this area. Imagine that this is a cell. So inside, this is a cell. Everything here is inside the cell. This is all outside the cell. Now, on the cell surface are insulin receptors. Insulin receptors are basically gatekeepers for glucose channels. So here in my diagram, glucose channels are here. These are GLUT4 channels that are insulin operated. So if we go back here, insulin receptor, here is the insulin. When that insulin comes and binds with the receptor has a part that crosses the cell membrane and is appearing on the inner side. Many receptors actually have this structure. That part of it is outside to bind with some substrate, and then part of it is inside to allow the inner enzymes to start working. This is just like if somebody comes in and rings a doorbell. So the button is outside, but then the bell is inside and the responding elements are inside as well. So this is exactly the same behavior. So the first action of berberine, let's just get done right now. Berberine, when given, works on the nucleus of a cell and increases the production of the messenger RNA, which in turn the messenger RNA for insulin receptor. So when the messenger RNA for insulin receptor is produced, that messenger RNA will come out of the nucleus, it will go to the ribosomes, and ribosomes will produce more insulin receptors. Those insulin receptors will be then expressed on the surface of the cell. This is called upregulation of the insulin receptors, and this is done by berberine. There are many mechanisms that do it. Berberine is one of them. Now, when the insulin receptors are increased, imagine there is, instead of this one receptor, there are many, 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 many receptors. That means that if, let's say, these are all the receptors and these are all the insulin molecules, now these molecules have a lot more doorbells to ring. So these molecules have a lot more chances to cause an effect inside the cell. So this is what we will call an improvement in insulin sensitivity or a reduction in insulin resistance. Although, please remember, insulin resistance reduction is not just this. There are actually more mechanisms for that. For example, the insulin receptors become less operational when fatty acids start clogging this area, when the fatty acids start binding here, and when the inflammatory markers can start interfering with the operations of the cell's internal mechanisms. And that would also be insulin resistance. So just having more receptors is not the solution for the resistance. But you would see in the talk today that not only there are going to be more receptors, but berberine would help reduce the fatty acids as well. And that would also improve the insulin resistance or reduce the insulin resistance through that mechanism as well. Beautiful, magical molecule. Okay, so this one is done. Now, I'm going to go to this side for a second before we go back towards the berberine. So here is a mitochondria. If you see, it is a little sad, and I intentionally made it sad so you can keep it in your mind. It would stick in your memory. So when berberine is given, so in this diagram, anywhere you see this block-like arrow, that means it blocks or it stops, or it affects something to reduce its function. When berberine is given, berberine goes and acts on the electron transport chain in the mitochondria of the cell. So we have done the discussions of electron transport chains, that within the mitochondria, there are some enzymes present on the inner membrane of the mitochondria that are called electron transport chain. There are multiple complexes in there. Imagine if you are in a kitchen and you have an assembly line to cook. For example, you have a sink with water, you have a cutting board where you put things and cut them, then you have plates, and then you have ovens or the stoves, and then you have a table where you eventually bring your cooked items. So similarly, electron transport chain is a set of enzymes that work with each other to produce energy. The very first enzyme in that set is called complex 1, very creatively. So, right? Berberine. So the first thing to remember, berberine acts on the complex 1 of the electron transport chain inside the mitochondria. Now, also remember, metformin does that too. So this behavior of metformin and berberine is very similar. Now, when the electron transport chain complex 1 is blocked or reduced in its activity because berberine has bound to it, what will happen? That function of electron transport chain will reduce, and the function of ETC, electron transport chain, is to make ATP, energy. Plus, its function as part of this is to consume oxygen. So oxygen is consumed, nutrients are consumed, and ATP is produced, and carbon dioxide is produced. Good. Berberine impacts the complex 1. The result is oxygen consumption reduces. ATP production reduces. When the oxygen consumption reduces, ATP production reduces, then what happens is there are many things. For example, one simple behavior. The cell says, Oh my God, I have less ATP, I have less energy. I need to go and find glucose within me and break it down to make energy. Cell doesn't know that there is berberine that is interfering with my complex one of the mitochondria. So cell goes and starts finding glucose molecules that are sitting in the cell, and it starts breaking them down. That is called glycolysis. So you could say that what is the benefit of breaking down the glucose inside the cell? Well, the benefit of that is that the concentration of the glucose inside the cell will reduce, which will allow more glucose to come in more easily, because glucose through the transporter channels work through the concentration across the concentration gradient. Glucose has to be more outside and less inside for the glucose to move in. So first function, with this indirect behavior and causing of upregulation of glycolysis, berberine promotes the uptake of glucose from the environment inside the cell. Guess what will happen? Not only the cell will get more energy, but outside the cell, the glucose levels will reduce. So hyperglycemia will start reducing because glucose uptake is improved. Now, this behavior of berberine is independent of insulin. This is very important because at some point it was thought that berberine goes to pancreas and releases insulin, as I taught yesterday, and that is the mechanism. But that is not only the mechanism. This particular study actually shows the mechanism of berberine independent of insulin. So see, insulin signaling pathway was not altered in the liver. So this is insulin independent pathway. This is a gem of our discussion today because many berberine presentation or presenting teachers do not talk about the insulin independent mechanisms. They talk about more insulin production or the more expression of the insulin receptors, but they don't talk about what happens inside the cell. So this is a gem today. So glycolysis is one. Second, because ATP is less, guess what will increase? AMP. What does that mean? Look, we have adenosine. Let's say this is a little molecule of adenosine or adenosine, whichever way you want to pronounce it, or whichever way is the right pronunciation. So here is adenosine. With the adenosine, we attach phosphates. When one phosphate is attached, we call it adenosine monophosphate. One phosphate. Then we can spend energy and attach another phosphate over here, and that will become adenosine diphosphate. Now, the second molecule here, when you break it away, it will give off energy. But normally, breaking ADP is more difficult. We attach another molecule and then we make ATP, adenosine triphosphate. And this third phosphate, removing that is easier. And whenever you'll remove that, it would release energy. This is the battery of the cell. This is our primary function of our life. If we don't have ATP, we cannot exist. So when you're not making more ATP, then of course more adenosine will be present, adenosine monophosphates will be present, and less ATP, adenosine triphosphate, will be present. So can I say that the ratio of AMP to ATP, so ATP to AMP will reduce, the ratio of AMP to ATP will increase, right? So as this ratio becomes altered, as there is deficiency of ATP, there is an enzyme called AMP kinase. Its function, it does many jobs, but its function is to sense reduced ATP and then trigger activities to improve the energy in the cell. See what berberine is doing here? So one of such function is that AMP enzyme, AMP kinase enzyme, will trigger the movement of glucose receptors from those little tiny bags called vesicles to the surface of the receptor. So to the surface of the cell. So the cell is going to now express more glucose transporters, which would allow more glucose to come in. And We already saw that we are breaking glucose quickly as well. So that would create reduced concentration of glucose inside. So the glucose outside would actually more happily come in. Isn't this beautiful? So berberine, just by this little touch, it has already caused the glycolysis and already expressed more glucose channels and already are enabling the cell to pick up more glucose, especially. So this is not just hepatic, this would be peripheral channels as well. Result: lower glucose in the environment. Hyperglycemia would start reducing. So do you see how many mechanisms are working together because of berberine to help with type 2 diabetes mellitus, or just the glucose levels that are increased? Okay, continuing. Another thing that berberine does is that, of course, as it has reduced the energy, the nucleus of the cell senses the reduced energy as well. And it says, you know what? I should not make all kinds of proteins. I should only do most essential works. It is very similar to our behaviors as well. For example, if we run low on money, remember ATP is the money of the cell. If we run low on money, what will we do? We will do the most essential things and not do or not spend money on less essential things. Same is the behavior of the cell. You take away its energy, it's going to spend the energy on the most important thing. So nucleus starts focusing only to make those messenger RNAs that are necessary absolutely to keep the cell functional, but not make extravagant enzymes. And what does that mean? In that process, the nucleus starts to produce less messenger RNA for making the enzymes called PepCK and G6Pase. So once again, you'll say, well, what the heck is PepCK and G6Pase? And let me explain that for a second. But first, just this concept. Think about it, that have you gotten this concept? When the energy is low, nucleus is only going to make the most essential enzymes. In that process, the PepCK and G6Pase enzymes are deemed to not be the most essential. And now we're talking liver cells. So what does that mean? What that means is the following. In our liver, when we are in a fasting state, for example, in the morning when you wake up, or anytime you're fasting, for example, I eat food 7 in the morning and then about 12 or 1, and that's it. That's my whole day's activity. So within 8-9 hours, I am in a fasting state. Until the morning, I am quite in a fasting state. During the fasting states, we still need glucose to be maintained at 80 milligram per deciliter, right? The basal glucose level. So how is that maintained? Our liver makes glucose. That is what is called glucose, new, genesis, production, new glucose production, de novo glucose synthesis, production of glucose by our own body. You don't have to eat glucose or glucose things to have that glucose. It is the liver who's going to say, you know what, I think I need to make glucose. So in the fasting state, glucose starts being made. The problem is, those of us that have developed diabetes, we actually already have glucose in the body, but that glucose is not entering the cells because of the peripheral insulin resistance. So liver thinks we don't have glucose, and liver abnormally starts making glucose. So now we have a double whammy going on. On the outside, we are getting glucose, and that is running around in the body and causing damage by sticking to various proteins and enzymes and disrupting their function. And then our liver is also now producing glucose. We should have asked the liver that, hey man, stop making glucose. So in normal healthy individuals, in such state when there is enough glucose and then insulin present, liver will not make glucose. These enzymes, PepCK and G6Pase, phosphoenol pyruvate carboxy kinase, that is PepCK, and glucose 6 phosphatase is the G6Pase. Their function is to help make new glucose from pyruvate. And if you see here, this line actually is related to insulin. This is the function of making new glucose that is inhibited by insulin. When think about it, insulin, when does it present? When is it more in our body? When we have more glucose. When we have more glucose from food, do we need to make more glucose in the liver? No. So the insulin actually reduces these enzymes function and blocks the gluconeogenesis. Berberine does that too. By downregulating the production of messenger RNA for PepCK and G6Pase, berberine attacks this area directly, reduces these enzymes, and more glucose production reduces. This is a hugely important part for diabetes. Gluconeogenesis in fasting state, and the liver could actually think the whole day is a fasting state even when you're eating food, because it does not know that glucose is there, because it is resistant to insulin's action. So another important thing. Now, generally, how does insulin work with this one? So think about it. Follow me here. Let's say here is the insulin, comes and attaches to the receptor. Inside the cell, there is a receptor called insulin response substrate, or insulin receptor element inside. Then this response substrate will cause another enzyme called PI3K to be activated, which in turn causes another enzyme, which is the hub of the insulin response system, is called AKT. That becomes activated. When AKT is activated, it brings more glut to the surface, which berberine does that too, through AMPK pathway. And more glut to the surface will mean there will be more glucose coming in the cell. That's what insulin wants. It wants the cell to take up the insulin, in glucose. In addition to that, see this block diagram? AKT blocks an enzyme called FOXO1, or fork head box 01. When FOXO1 is blocked, it reduces the production of these, and gluconeogenesis is reduced. That is insulin pathway. Berberine does not actually activate this pathway, but independent of that, it can reduce the production of PepCK and G6Pase, and reduce gluconeogenesis. What a wonderful gift it gives to the liver, because it is not only less glucose produced that would go in the body and cause hyperglycemia, but also this glucose can then be converted into fatty acids and become accumulated in the liver. So three mechanisms now, right? We have the insulin receptor expression, mechanism number 1. Number 2, glycolysis increase. Number 3, glut receptor expression. Number 4, gluconeogenesis reduction. Let me go to the next one that is the most beautiful. That is this one. So let me show you through insulin first. Insulin comes and attaches with the insulin receptor. That causes the receptor substrate to become activated on the inner side. That causes PI3K to be activated. That causes AKT to be activated, which then blocks another protein called TSC1 and TSC2 proteins. These proteins usually keep mTOR C1 enzyme blocked. When insulin blocks this enzyme, TSC, then mTOR becomes disinhibited. There is no one to stop it from functioning. It says, all right, now I'm free. I can go do whatever I want. And what does it do? It activates SREBP1 and S6K. I'm going to leave the S6K function for the time being. Actually, you would see that it actually works back here. So we'll leave that out. SREBP1, in turn, this enzyme causes fatty acid synthase enzyme to become activated, and that would start making fatty acids, lipids, and will start having fats. So insulin brings glucose in the cell, especially for the liver, then helps convert the energy into lipids. This goes wrong in diabetics because now we are converting unnecessary fats, or this mechanism is incorrect. Guess what berberine does? I think you can already see what berberine is going to do. So here is the berberine. Same behavior, that when it reduces the energy and that causes the nucleus to produce less enzymes, one of the enzymes that is also deemed less essential in the presence of berberine is this enzyme, SREBP1. That enzyme's reduction reduces fatty acid synthase enzyme, which then reduces fatty acid synthesis or production of the fatty acids. When fatty acids are less produced, then we have less lipogenesis. We have less lipid production. We have less hepatic steatosis. Hepatic steatosis is fatty liver. We have less fatty acid synthesis. We have less fatty liver, which will then over time, not in one day, so I take it today and tomorrow my liver is healed. That is not the case. Over time, it would continue to chip away at the fatty acids by reducing the production of fatty acids. I should say chip away at the fatty liver by reducing the production of fatty acids and the production of triglycerides, of course, as a result of this. And it also helps reduce the cholesterol. All of those functions result in improved hepatocyte function, or the liver cell function starts improving. When liver cell function improves, then liver cells do not unnecessarily engage in hyperglycemia, because now the liver cells can understand that there is insulin. Plus, they can understand that I do not need to make more glucose. So gluconeogenesis is controlled, plus fatty acid production is controlled. The whole metabolic state becomes stabilized. Some of those functions are immediate. Glucose control is immediate. And of course, it is not the entire full control. Depends upon the person's how much glucose is present, how much berberine is present, what are the other factors there. But that is a more immediate thing, that it would help reduce the glucose levels. The fatty acid synthesis reduction and liver healing is a long-term effect, but it is a very important effect. When I was talking with Dr. Paul Merrick about this, I thought the most important gift berberine gives us is to help our liver. But at the same time, please make sure it has interactions with the blood thinners, it has interactions with other drugs as well, because it works with the liver and it can cause the liver enzymes to behave differently, that can cause other drugs to behave differently. So this particular video, this particular talk is not to say go get berberine, but to explain what it does. You still have to talk with your doctor, figure out what is the right thing to do, and then go there, because it augments. Imagine if you're type 2 diabetic, you may already be taking many other medicines. It can augment the effects of them. So please be very, very careful. Hypoglycemia can be very dangerous. Okay, so beautiful mechanism on the liver. If I just present this is it that I wanted to discuss today. I have already discussed this mechanism on the beta cells yesterday, so I'm going to leave that out. This is the basic mechanism. So bigger picture, just a quick summary. Insulin pathways for gluconeogenesis and lipogenesis. Independent of those pathways, berberine actually works to reduce gluconeogenesis and lipogenesis, but it interferes with those pathways in a positive way. That is the basic effect. In addition to that, it causes glycolysis or glucose breakdown. In addition to that, it causes more glucose uptake from the environment, which would also reduce hyperglycemia. That is an effect positive outside the cell. So it is helping the cell inside. It is also helping the environment by taking the glucose and picking it up. It is also increasing the insulin receptors, which would also help pick up eventually more glucose. More insulin will bind, and that would cause more blood channels, more glucose will be picked up. So hyperglycemia in the environment will be reduced, new gluconeogenesis will be reduced, new lipid formations will be reduced, existing glucose will be taken up, and the cells would become happy cells. This is the Berberine talk for today. I think yesterday's talk and today's talk should be seen, watched in a combination. And then I would discuss other mechanisms. But before I discuss other mechanisms of berberine, I want to discuss the side effects and the drug interaction in my next talk. Then we'll go on a journey for other cardiovascular effects and blood lowering effect and vessel healing effects and other such effects. So this is the discussion. Thank you very much for joining me. My apologies. I came in a little earlier today. I had a little appointment in the evening. Please like, subscribe, and share. This is very important for us to have a lifestyle and have things in our life that help us be healthy. Healthy, long life is good. Unhealthy life becomes cumbersome, tedious. So please share these as well, use these as well, talk with your doctor, make sure that you have done your research. I actually took berberine yesterday and this morning. I didn't have any side effects. I took 600 milligram last night and 600 milligram this morning. And so far, so good. So with this, thank you very much. I will see you on Monday. Happy weekend. There are links in the description of this video if you would like to support this work. Bye-bye for now.